Well, that's terrific, and I'll sort of summarize the past 35 or 40 minutes. There's tremendous opportunity for orthopedics in the future. It's a good business. It's probably going to be more challenging in the future than in the past, but there are unmet patient needs. There are opportunities for technology, opportunities for innovation, and at all levels of the business, opportunities to do well. We're going to give you a chance to ask a few questions in the remaining minutes that we have. I think we've got a microphone circulating, so as you think of your question, get your hand in the air. While you're doing that, I want to ask our panelists one last question for their thoughts. So, gentlemen, imagine we are attending OMTEC 2017 in 5 years. From your perspective, what is the one thing that has most fundamentally changed in orthopedics 5 years from now than where we are today? Bill, Kolter, let me start with you.
Well, I think one of the things that we're already beginning to see is the impact of policy on the relationship between surgeons and hospitals. Certainly in the healthcare reform bill, there were policies written that were intended to encourage physicians or surgeons and hospitals in our case to work more collaboratively to provide more cost-effective care. That value-based purchasing, bundling, gain sharing that's included in the ACO legislation, that as well as just the ongoing pressures of running a private practice are making hospital employment and other types of arrangements, ACO type arrangements, joint ventures, more attractive to surgeons, which in turn I think over time is going to make them more value conscious than perhaps they've been in the past. So you're going to see, I believe, greater collaboration between surgeons and hospitals, but I don't think that's necessarily a bad thing. I think that is going to provide, again, ongoing opportunity for innovation and efficiency. I think it provides opportunities for us to tell our value story more effectively, and it's just going to be a bit of a paradigm shift compared to 10 years ago.
Yeah. All right, so changing relationships between physicians and hospitals working together, change the dynamics of the industry somewhat, and some aspects of that are probably going to be good for the industry because, quite frankly, it's going to force the industry to be a little bit better at thinking about value as well as technology innovation. Bill Plovanic, what do you think 5 years from now?
I think Bill hit it, efficiency, and the way I see it is the trends that are occurring in the end user market today are focused on customization and just better implants for the patients. And I think efficiency in terms of the instrumentation, the 800-pound gorilla in the room is, these large companies spend billions every year on the instrumentation sets, and they have to have multiple sizes. And that's, if you think about the other industries out there, this is probably one of the most capital-intensive medical device sectors there is. And I just believe that's what these companies need to improve. So it's going to be less steps, simpler instruments, fewer instruments to get to that, but with better patient outcomes. So, and that would just mean probably fewer suppliers, which I know probably won't make me a fan of this panel, but but the companies that can provide those services, I think, will do very well.
Clinical efficiency and capital efficiency.
Yes.
Yeah. Brian.
Yeah, building on those 2 points, I mean, if you look at the classic business approach to pricing pressure, it's to debundle. And at the moment, the whole of the orthopedic industry recovers virtually all of its costs, profits, the lot, on the sale of a joint. So if you look at the airline industry, what is the equivalent of starting to charge for getting your boarding pass printed in the orthopedic industry? Are we going to be seeing more revenues coming from surgeon training? Are we going to start charging for instruments? Are we going to do things? Because if you just keep that one target there of that one joint, it's a huge target for the specialist buyers, and they hit it. So I would see that the OEMs have got to somehow, somewhere, debundle, and that'll obviously flow down.
Yeah, Bill, we used to be unbundled, didn't we? And then we all bundled it up, and maybe it's time to rebundle again. Charging for instruments, that'll warm a lot of hearts in the room, too.
Now you're a great big target for everybody. Yeah.